So this is the question that we are going to essentially try and cover is what can be done to encourage evidence-based, environmentally sustainable policies to promote human health, well-being and prosperity. So the members of the roundtable are a group that we've got together. So the first we've got Professor Sergei Shubin. Professor Shubin is Director of the Centre for Migration Policy Research at Swansea University. His research interests are migration, poverty and inequality, and he's a recognised expert on these topics and regularly advises government and other significant organisations about these issues and has done a huge amount of work on those. So thank you, Professor Shubin, for coming today. Our other panel members are Dr. Claire Gordon. Dr. Gordon, you have just met because she announced the winners of our posters. Dr. Claire Gordon is an infectious disease and clinical microbiology consultant. She works at the UK Health Security Agency, the UKHSA. She has a keen interest in health systems strengthening, particularly in improving access to diagnostic microbiology to optimize the use of antimicrobial agents. She is now the Deputy Unit Head of the Rare and Imported Pathogens Laboratory, which is the UK's frontline laboratory for diagnosis of rare, unusual and dangerous viral and bacterial pathogens, particularly those imported from overseas where diagnosis and infection are particularly challenging. So thank you, Dr. Gordon, for coming today. We've got Dr. Zoe Parner, is a professor at EUC. Dr. Parner specialised in epidemiology, infection prevention and antimicrobial stewardship at Johns Hopkins Hospital in the USA. And she's a member of the European Committee and Guidelines Group on Emerging Infectious Diseases. She participates in EC projects and focuses particularly on building the clinical research infrastructure on epidemic preparedness. And finally, we have Dr. Shirlene Kassam, who is a consultant hematologist and honorary senior lecturer at King's College Hospital with a special interest in the treatment of lymphoma. She's also visiting professor of Winchester University in Hampshire, where she developed and facilitates the UK's first plant-based nutrition course. She's passionate about plant-based nutrition and its role in chronic disease management and maintaining optimal health. And she founded a plant-based health organisation in 2018, which is a non-profit organisation based around promoting this. So thank you to all our panellists. Okay, so because I know that you've all agreed questions beforehand and I wouldn't like to randomly make them up because that would cause problems, wouldn't it? So first of all, Professor Shubin, thank you very much for coming. So our first question to you, Professor Shubin, is what sort of transformative thinking is required to address the challenges posed by the climate change for world populations?
Thank you very much, Mike, and thank you to Kelly and Howard for inviting me to take part in this event. This is very interesting. I'm hopefully going to add something different to it. I mean, it's great to hear discussion led by the pathologists, but I'm going to bring hopefully a little bit more human side to it. And what I want to do today is just to talk about two things, if I can just focus on two issues. First is how we can think about relationship to the future differently, how we can sort of think about adaptation to climate change differently. And then secondly, how we can think about the perhaps more than rational ways of relating to climate change and its effects, particularly on human health. So I'll start with the first point. And why am I talking about the future? Because climate change is all about the future. You know, we can look at the projections made by scientists. We look at the way in which politicians then try to sort of develop measures to adapt to climate change. It's all about planning for the future and thinking about how we're going to live in the future. So we need to ask ourselves, how do we make sense of the future and develop these different scenarios? And the problem is that traditionally we tend to think about the future as something which is currently unknown, but we kind of make it known later on. It can be modeled of our experience of today. We can see quite a lot of models which go back so 100 years and then project what's going to happen to us 100 years from now. But the future is not just about endpoints or targets. It is kind of continuous process of adjustment and living with change. And our perception of the future climate change is often governed by sort of long-term goals or points. So we encourage to think about the ways in which carbon can be reduced or concentrated, in 100 years' time. And it's often appeared far removed, and it's very difficult to relate what's going to happen in 100 years. But life is not just about projection of things into sort of mappable domain called the future, but it's about exploring a particular way of life. It's about opening new possibilities. Future is not just about end state, which is characterized by some sort of achievement, carbon reduction goals, but it relates to commitments which shape our life. So we kind of committed to trying to deal with the unjust world, or living with the sort of changes which we have to adapt to. So, of course, I'm not denying the fact that we can achieve this kind of climate goals, and we can organize activities to pursue it. And we've seen quite a lot of examples already today in terms of how the Royal College of Pathology is trying to do it. But we cannot just say, we achieved it, we are sustainable now. This is something which it's about continuous living. We cannot say today we're sustainable, no more, done, dusted. We're no longer trying to do anymore. So it's about continuously trying to do that. It's a process. So if you think about future and our relation with the future as something which is ongoing and developing rather than an end state, how do we then plan for the future? How do we think about the future differently? First, it means we need to think about vulnerability as a dynamic process rather than a state. And vulnerability is often considered in very static terms. So something which can be described, for example, a characteristic attached to a particular group of people. So we hear about vulnerable women or vulnerable migrants, and describes different capacities of these groups to adapt to climate change. But we need to consider vulnerability of human life in a kind of broader sense. And as pathologists, you're probably aware of it, trying to describe the potential to exposure to different influences, to different illnesses, to death. So different kind of vulnerability, which makes us all human. Vulnerability then becomes a process which is reflecting adaptation to climate change, which is always dynamic, time and place specific. And secondly, we need to also think about planning and preparedness. We need to learn how to live with uncertainty altogether. And I want to use the examples of the project which we did recently with colleagues across Europe. I put a link here on the chat, which focused on the ways in which we kind of rethink the experiences of COVID-19. It was the COVINFORM project where I was leading a Swansea-based team. So during the pandemic, we learned that the government's planning and initial responses were originally based on something they knew before. So they were trying to, in the UK particularly, base their responses on the plans which they created for the spread of flu. However, these responses had to be adjusted to the new challenges because the virus was changing itself, was mutating, and the conditions of life were changing very quickly. So it became apparent that it wasn't just about logic of calculation and risk. We've seen these models projecting how many people are going to die according to different scenarios, and they didn't quite always play out as expected. But this was often also linked to economic terms, in terms of how economy is going to fare. But pandemic responses also had to include the new practices of dealing with uncertain futures. How long does pandemic last? What's going to happen? Does it stop? And thinking about different ways of living together. What does it mean? Kind of how do we tackle isolation, for example, or how support people who live with loss, different kind of thing, how immediacy of death, which we all witnessed. What became apparent that pandemic had a really significant effect on mental health. Well, originally it was all about, physical health and the effects of physical health prioritized. So what I'm trying to say is that based on these examples, we can think about future differently, how we can go beyond the logic of economic systems of environmental governance and risk calculation in relating to the future and anticipating change. We need to address climate change, particularly in terms of issues, in terms of its effects on mental health, things like climate distress, and consider a whole variety of surprising, unpredictable ways in which people are shaped by climate. So to this end, we can develop new forms of engagement. We can use creative ways of kind of telling the story. And we talked about communication earlier, how important it is for the Royal College of Pathologists to do it in different kind of ways. And we kind of use this in the work we did in Bangladesh in particular, where we tried to use children's storybook and film. And I'll put a reference to it later on when I have a chance to do so in the chat. The second thing I want to talk about very briefly is how climate change is kind of a more than rational thing, and we have to develop more than rational responses to it. It can come really it's potentially problematic. I'm talking to the pathologists who really think about it in very rational ways, but give me a chance. I'll try to explain myself. So for the long period of time, climate scientists think about people and human agency, trying to understand how people drive climate change and what kind of effects climate change has on them. But very often people are kind of used as a black box. You sort of grouped under human factors, conditions that affect change, but we don't consider the desires, the emotions which undermine it as much as we do kind of focus on other effects. But we don't really live in the world which is determined by sort of measurable characteristics. It's not just all about distance, temperature, and humidity. We are developing kind of measurable relations of living with beings and adjusting to life much more difficult. And to reflect this interconnected being, climate scientists are now getting increasingly concerned about these more than rational aspects of human experience. And they're trying to think about how we can go beyond measurable and instrumental analysis of human environmental dynamics. So what they try to do is they try to explore the forces which produce different encounters between humans and other objects and drive people to act. Such forces often produce different intensities, bodily reactions. They broadly described as affects. And affects, we kind of come across them very often, things like love, anxiety, fear, joy. They prompt certain kind of action. They develop certain relations between different bodies, things, and technologies. You can think about the emotive responses people have to the extreme weather events, when people, send money to the distant people or try to support someone who is in need. And the climate scientists increasingly focus on these affects to explore embodied, experimental, and emotional forces which shape social natural change. And again, to illustrate how it works with the context of health, I want to use the examples of this study which we completed, COVID-informed study, which I mentioned earlier. During the pandemic, COVID-19 virus, it wasn't just about spread of contamination and disease, but it was also producing differential effects such as anxiety and fear. In fact, social scientists went as far as to say, as Horton notices, that fear became a new organizing principle of our society, which aggravated existing inequalities. We'll be worried about what's going to happen to us. So the uncanny presence of the virus haunted everyday realities and shaped everyday responses to it, created new kind of exclusions. People found themselves isolated. People were dealing with shielding, which affected their mental health. So at the same time, fear for the others also created a sense of urgency and moved other people to help those in need. So these affects really worked in different ways, producing gaps in rational reasoning. So even the healthcare responses or the government responses were kind of really confusing sometimes because they were emotionally driven. And we can learn about it quite a lot now in the ongoing UK COVID inquiry, how there was kind of unpredictable, unprecedented responses there. So similarly, living with climate change produces anxiety and fear, especially when people feel helpless in the face of uncertainty. At the same time, anxiety can be a positive force. People can feel they need to do something about their children, and they can kind of act together for the social change. So it's important to consider transformative potential of affects and new possibilities they offer to address climate change. Affects can be used to generate social change and provide responses to climate change that go beyond technological solutions. For example, we need to make people comfortable with being uncomfortable about the changes posed by climate. And also, we need to kind of think about different ways in which we can make potential interventions attractive. It's not just about sacrificing, giving away, don't eat meat, don't travel, but think about something other ways of playing on these effects, mobilizing them for different use. So to summarize, what I did today is I tried to argue that it's important to develop different thinking about climate change, particularly with its effects on health. It is important to go beyond technological solutions and support emotional resilience and consider a broader variety of risks that climate change entails. We need to pay attention to different and contested experiences of adaptation to climate change in different places and times, and ultimately address social inequalities that support unsustainable lifestyles. Thank you.
Thank you very much. So thank you, Professor Shubin. Moving on to Dr. Gordon. Global warming is leading to an increase in the proportion of global populations at risk of infectious disease. Could you give us some examples of types of infection that are already expanding their range, and what should we be particularly worried about?
Great question. So we heard earlier today with Dr. Abaka and Prof. Murray some examples of infections that might be expanding their reach, and in particular dengue. But I think there's two main areas where climate change is going to impact on infectious diseases. So the first is on changes in vector distribution, but it's more complex than just the climate change. It's actually how humans interact with their environment, and where we disrupt habitats, we not only disrupt the vector distribution, but also reservoir animals. And so if we displace reservoir animals along with their vectors, you can see that that poses a significant risk for humans. So it's really to do with how humans interact and manipulate their environment. So we've had the example of dengue. Chikungunya was mentioned as another vector-borne disease. From the UK in the past year, we've seen our first tick-borne encephalitis cases that have been UK acquired, and we've seen a UK acquired or presumptive UK acquired case of France Dizella. So those are both vector-borne diseases. And we've also had a couple of cases of malaria in the UK. Malaria has also been seen more frequently in Europe this year in patients without a history of travel. It's probably not just climate change that has affected that. It's a complex interlinking of climate change, increased travel, so people are coming back to countries infected with what would otherwise be considered as exotic diseases, and then the impact of human interaction changing our exposure to vectors and our exposure to reservoirs. So those are the sort of exotic diseases, and there's a whole list of vector-borne diseases that might be changing their reach. But the other impact is probably a change in standard diseases, so diseases that we might expect, but where you have climate change resulting in extreme weather events, then you might see disrupted infrastructure, and you particularly see that where water sources and sewage are affected. So flooding is a clear example where climate change leads to flooding, leads to an increase in waterborne diseases, so standard diseases that aren't really emerging, things like cholera, Shigella, that have been around for centuries, and then the subsequent disruption in supply chains for essential medicines, vaccines, etc., so that we can't treat and prevent onward transmission of those, and then also risks from displaced people. So where you have an extreme weather event and people are seeking temporary accommodation, short-term refuge, you'll have overcrowding. And that's a perfect storm, if you like, for transmission of infectious diseases. So there's lots and lots of different ways in which climate change, I think, can affect transmission, both in exotic diseases and also in diseases that we've had in different countries for a long, long time.
Thank you very much. And one of the major challenges that the colleges has been trying to raise aware of and continues to do is antimicrobial resistance. What do you think the impact of climate change has had and is having on the exacerbation of antimicrobial resistance?
So definitely not going to help it. So both antimicrobial resistance and climate change are described in sociology terms as wicked problems. So these are problems that have multiple complex drivers and multiple complex effects. So basically with AMR, you're throwing a wicked problem at another wicked problem, and it just adds to the very complex mix. In human health, for example, we've talked about the likely increase in infections related to climate change, and that's almost certainly going to result in an increase in antimicrobial use, and that's one of the main drivers for the emergence of resistance. So unless you have ready access to diagnostics, if you're seeing patients presenting with unexplained, undifferentiated fevers that you don't have an explanation or diagnosis for because it's outside its normal geoepidemiology, then our natural reaction is to treat that with the broad spectrum antimicrobial. So I think that's one way in human health that climate change is likely to affect, to increase the issue of AMR. In agriculture, we've also seen lots and lots of efforts made to reduce antimicrobial use in farming, and particularly as an accelerator or a growth accelerator, and to permit high intensity farming. And we're trying really hard to roll that back because we recognise the impact both on human health and animal health of increased antimicrobial use in agriculture. But again, climate change, extreme weather events may impact our food security. So they may impact our farming, availability of farming land, availability of grazing. For example, if there's a flood that wipes out pastures. So we might have again to turn to antimicrobials as a quick fix to increase yields and permit intensive farming, as happened after the Second World War. And that was one of the reasons that antimicrobials were used as a growth accelerator. It was to combat food shortages. So we might end up seeing a rollback of all those efforts that have gone to reducing antimicrobial use in animal husbandry. And then a third aspect is the environment. So we're not entirely sure how the presence of antimicrobial residues in the environment impact on human health, but we assume that that is a risk factor for the emergence of novel transmission. So again, these extreme weather events where you might see flooding, you might see lack of control of sewage, you might see overuse of antimicrobials, and then subsequent excretion of compounds into the environment. That is a real ideal soup, if you like, for bringing together pathogens of human consequence and antimicrobial residues that again might drive emergence of novel resistance, which will impact on human health. So that's a very sort of simplistic view of what is a complex problem. But I think that's a nice illustration of the different factors that might impact AMR from climate change. And as I say, it's two wicked problems together. So a really significant impact potentially on human health.
Thank you very much. And moving on now to Dr. Parna, who on a typical topic, on a similar topic, you and your team have alluded to antimicrobial resistance, as in fact Dr. Gordon has just said, about as being a wicked problem. Can you just expand on what is meant by the term wicked problem and why antimicrobial resistance is one, building perhaps on what Dr. Gordon has just said?
Yes, of course, Mike, and thank you very much for the great question. But first of all, I would like also to sincerely thank the organizing committee for the honor and the privilege to be here with you. Answering to the question, so wicked problems are by definition highly impervious to resolution, often because they are difficult to be defined, but most importantly, because they arise from interdependent and multi-causal factors that are socially complex. And as a result of their complexity and instability, wicked problems often have unforeseen consequences, making their clear solutions difficult to identify. And when solutions are evident, they do not sit in one jurisdiction and often involve changing societal and individual behaviors. So in that sense, AMR is indeed a wicked problem due to both its causes and solution being founded upon behavior of multiple jurisdictions at numerous levels of the society, from microcosmos, the microorganisms, to individual governments and multinational corporations. And due to common behaviors associated with these stakeholders, driven maybe by lack of education and economic incentives, AMR is currently occurring in the society at an exponential rate, at the point where we are now, we can say, at the dawn of a post-antibiotic era. So for the future, this would probably mean that the majority of disease-causing bacteria will be resistant to our antimicrobial armamentarium. So AMR is indeed a multifaceted issue, having the potential to cause considerable burden of disease at the global level. So according to WHO, currently more than 1.7 million people and deaths are attributed to AMR. And according to WHO predictions, by 2050, AMR will cause more deaths than cancer, with a total financial health burden of 100 trillions. And please, when we discuss about AMR, we need to refer also to the fungal kingdom. So again, according to a recent WHO 2022 report, few fungal species currently are regarded as a serious emerging public health threat with increasing resistant rates globally, like, for example, Candida auris or azole-resistant Aspergillus species that can be found currently not only in the hospital setting, not only in the immunocompromised host, but also in the community and in the environment. So metaphorically, AMR can be thought as a butterfly effect, with one microorganism being able to multiply and transmit resistance worldwide. And it's related, of course, with several factors. We have discussed about them. First of all, the microbial, the bacterial, the fungal factors, the adaptation, the adjustment process, the ability to transmit resistant genes. Human factors. We have discussed several times about the misuse and the overuse of antibiotics, not only in healthcare, but also in the environment. And other external environmental factors that are currently drivers for AMR, such as climate change, but also globalization. So it's like having a borderless threat in a way. And this threat and spread is fueled by a variety of stakeholders, from consumers to prescribers, from food production to hospital and governments. So to conclude, of course, the ability of antibiotics to cure infections has revolutionized medicine. But unfortunately, their success also caused individuals, society, and governments to abandon common sense of hygiene sometimes and quarantine practices and strategies. And due to this behavioral shift and the inherent nature of the microorganisms to adapt and adjust in a dynamic environment, we are now again in an era where we are unable to treat infections both at the community and in the hospital setting. For example, in the United States, approximately more than 6% of the hospital-acquired infections are attributed to bacteria that are resistant also to our last resort drugs. And of course, this evidence supports that there is an increasing global bacterial resistance burden, and it's alarming. So what we need to do, we need now to start coordinated actions to curb AMR from several sectors, and of course also to develop maybe alternative strategies. For me, I think number one, and it's also discussed by Professor Abarca, it's increasing public and professional and awareness and engagement. Number two is, of course, continuous education, and I mean multi-sector education and approach. Number three is sometimes we have enhanced and fostered fragmented research on this field. So we need to foster, first of all, sustainability and also synergies across several sectors. So multi-sectoral research on that topic. And of course, significant investment finally in R&D, in research funding that should be secured on this sector, with the possibility, of course, of evolving new antibiotics, but also to evolve new antibiotic alternatives. We have several research about bacteriophages and other developments. And with all that, and focusing on partnership that has been mentioned also before, I think that we need to focus on, generally speaking, infection control and antimicrobial stewardship strategies beyond the hospital setting in a multi-sectoral and, of course, integrated approach.
Thank you. And moving on to that, we hear a lot about One Health and the One Health concept. Could you just briefly perhaps tell us, you've alluded to the importance of a disciplinary approach, but how can pathologists and others work together to better achieve the aims that you've alluded to?
Mm-hmm. First of all, about One Health, just a brief summary. And it's actually very important to keep in mind that everything in nature, since we are discussing about planetary health, is truly interconnected. From social human networks to microbial networks. We know about the quorum sensing, I mean, the communication between the microbes, the communication and the interaction in our human bodies, and I'm talking about the human microbial ecosystem, our microbiome. So actually, we have evidence that everything is interconnected. And of course, at another level, we discussed about the gross borderless threat, I mean, the globalization and the human mobility. So having that in mind, we do understand that currently One Health is the only proven approach for policy making and cross-sector collaboration to prevent everything that we have discussed previously, from zoonotic to vector-borne diseases, emerging and re-emerging infections, food safety, reducing AMR, and of course, environmental issues collectively assessed to improve human, animal, and environmental health. So to answer to your questions, I think, again, we touched it previously, I think cross-sectional partnership, cross-sectional synergies. We already have established very good surveillance data, especially during the COVID pandemic, but now we need to think in a more broad spectrum. So surveillance data, as I said before, infection control and prevention strategies should be expanded beyond humans. So we need to integrate our systems, our research, and collaborate in a multi-sectoral way, which is pretty similar very similar to my previous answer, because I think this is the key point, cross-sectional and integrated synergies.
Okay, thank you very, very much. Moving on to Shireen. Thank you for coming. You are an expert on plant-based diets. Could you tell us what the environmental benefits of eating less meat are?
Yes, thank you for the question. I might just start, though, by setting the scene about how the global food system is really impacting all aspects of our health, and it really plays into the One Health agenda and approach to healthcare that you were discussing. So just so the audience knows that our global food system really is a leading driver of climate breakdown, including greenhouse gas emissions, but also biodiversity and nature loss, land, air, water and ocean pollution, land use change and deforestation, and more. And of course, our food system currently is hugely unethical. We produce enough food globally to feed more than 10 billion people, yet more than 1 billion remain hungry. And at the same time, we're slaughtering 80 billion land animals a year and 1 trillion fish for a food that in many countries we need to be consuming vastly less of, or could be avoiding altogether. And just to comment also about the fact that there are huge other impacts of our food system that have been alluded to already. Our interaction with animals, especially in the intensive factory farms where most of our food from animal sources are produced. So, for example, 70% of animal foods are produced in factory farms in the UK. They really are creating new infections that are putting us at risk of epidemic and pandemic infections such as bird flu. So there's already been recent reports of novel bird flu viruses that have been acquired by poultry workers, for example. And as has been mentioned, the use of antibiotics in farming is an issue. And so all of these problems can be addressed by moving away from a meat-heavy diet. But to move to the question that you actually asked, the food system currently is creating around 1/3 of all greenhouse gas emissions. So this is carbon, nitrous oxide, and methane. And or more than half of that is coming from animal agriculture. So as we move away from meat-heavy diets to plant-based diets, we have the opportunity to reduce greenhouse gas emissions from the food system by more than 50% if we were willing to really cut our meat consumption considerably. And then, of course, there's land use. We could free up to 75% of land used in farming if we were to adopt fully plant-based diets, on any percentage of that if we were just going to reduce. And so freeing up land not only allows us to restore it to nature, we can use as a carbon sink as well. So it's addressing twofold the opportunities to free up land, store carbon, and rewild. And that's there's also significant benefits for reducing water use as well, reducing air pollution. And we mustn't forget that there's co-benefits for our own health. So, I mean, the good news is that diet patterns that support planetary health are also better for us as individuals and at the population level. So at the moment, our diet or the food system is resulting in around 1 in 4 premature deaths. And in Europe, including the UK, around a third of deaths occur prematurely due to dietary risk factors. But moving towards a healthy plant-based diet could potentially reduce premature death by around 20%. And so there really are co-benefits. And, you know, if people aren't willing to go the whole way, for example, there's been a great new report, I'll pop it into the chat, just showing that if we reduced our meat consumption by 30%, so that's all of us committing to 2 meat-free days a week, we could offset all emissions from aviation by just doing that. We could save 7.5 million swimming pools worth of water every year and free up an India-sized carbon sink. So the opportunities are great. And if we limit meat consumption to 40 grams a day, which is around the size of a hamburger, we could reduce the use of antibiotics in the farming system by 66%, which again is pretty huge. So there are so many benefits that I could really carry on for a long time, but I'll stop there.
Okay, thank you. And if we all ate less meat, how much in terms of percentage, you've sort of alluded to this, could it make on greenhouse gases and global warming?
Yeah, so great question again. So as I said, 50% of the greenhouse gas emissions coming from farming are due to animal agriculture. So if we went all the way, if we adopted a fully plant-based diet like I have done for the last 10 years, we could cut emissions by 50%. So putting that into context, if we all went plant-based today, we could draw down 16 years worth of fossil fuel emissions by releasing that land back to being a carbon sink. So that's the amount we could reduce greenhouse gas emissions by. If we're wanting to take the most impactful step, it would be to remove the use of ruminant animals from our food system. So that's beef and lamb, because of the emissions of methane. So around a third of anthropogenic methane emissions come from the animal sector, particularly beef. And so we have a great opportunity to reduce this short-lived gas, which has huge warming potential and much of a greater potential for warming than carbon. And then, you know, another example would be that if we all moved to a plant-based diet, it's the equivalent of taking 8 million cars off the road. So it really is the single most impactful action we can take as individuals is to shift our diet, and it will improve our own health and that of the planet. But as I've mentioned, it's not just greenhouse gases we're talking about when it comes to diet. There's so many detrimental effects that are damaging our health, including the land, ocean and water pollution and air pollution as well.
Okay, thanks very much. And does the evidence in the UK and globally show how much of a shift towards plant-based diets is happening, and how can we encourage people to cut down foods that are harmful to the planet?
Yeah, no, it's a good question, and actually just last week hit the media headlines. A recent study showed that over the last decade in the UK, we've reduced meat consumption by about 17%. And a different survey has shown that around a third of households are buying plant-based dairy alternatives because, of course, dairy coming from cows has a huge impact on the environment as well. So we are making inroads, but I would say we are not making enough of a shift, and not fast enough, because high-income countries like ours are contributing the most to planetary destruction, environmental harm, and we have to make the greatest shifts. So in the UK, it's been suggested that we need to reduce our meat consumption by 80% to meet our nature and climate targets. So we have got a long way to go. So how can we achieve these shifts? And you know, if we're talking about a sustainable diet, we know that the maximum amount of animal food consumption has been documented by the Eat Lancet Commission, which suggests that we shouldn't be eating more than 1 portion of red meat, 2 portions of poultry, and 3 eggs per week, and that will keep the food system within planetary boundaries. And so how do we make the shift? Well, we need all key stakeholders to engage and take action. So at a government and policy level, we need people to put the science into action. We know what the solutions are, but we just need to be able to support individuals and communities to take action. So one key thing on a government level will be to stop subsidising meat and dairy and put financial taxpayer subsidies towards foods that not only promote health, but also reduce environmental harm. And the farming sector need to be supported to move away from animal-based farming systems. You know, we use 80% of land in the UK to raise animals for food. We produce far too much, we export it, and yet we're not even producing enough fruits and vegetables for all of us to eat 5 portions a day, as would be recommended by dietary guidelines. We then need to support change to the food environment like supermarkets, but importantly, where we can all take action is about changing public sector catering, because this showcases and normalizes healthy, delicious, nutritious, plant-based meals. So this can be in schools and prisons, but also healthcare professionals and institutions have a huge opportunity to play a part here. I'm sad to say that the last time I attended an RCPath study day, there was processed red meat on offer, and this goes against all your sustainability guidelines and doesn't promote health when it is a key driver of many chronic conditions. And the example is being set for New York, for example, 11 city hospitals are now offering plant-based meals by default. So their patients are given plant-based meals as the first, second, and third options. They can choose to add animals to their diet if they want to, but the default option is a plant-based meal, and 60% of patients have stuck to that over the last year. And the food emissions from catering have dropped by 36% in the hospital sector. So there's a lot to do. And then what I do as an organisation is provide education, knowledge and skills for all of us as professionals and public to have the correct knowledge, skills to be able to prepare and consume healthy, nutritious meals.
Okay, thank you very much. And thank you to all our roundtable panelists. I think we're going to move on now to questions submitted from the audience. If somebody would like to put the questions up, I will direct them to the person who I feel has the best capacity to answer. Here we go. Okay, so the first question is, what would the panel members' top tip be for recommending a small change to our professional or personal life to address climate concerns? So I'm going to go to Shireen first, because I reckon I can make a bet on what it's going to be.
Absolutely. I think I mentioned it already, but the single most impactful action we can take as an individual that does not require government policy change or anything is to remove meat and dairy from our diets. And if we cannot remove it, reduce it significantly. The National Food Strategy suggested we all need to reduce meat and dairy consumption by 30%. I would say to meet our climate targets, 80%. Commit to several meat and dairy-free days a week. You will not regret it. You'll feel good, you'll have better health outcomes, and you really will be doing the utmost for the planet, more than stopping flying or changing your car. Thank you very much.
Zoe, what would it may be the same, you can all say the same thing, but
actually I fully agree about reducing meat in our everyday. So I will have to admit that I was not considering that, but after the talk I will start it personally, and as a pediatrician also I will recommend it also for my let's say children that I follow up. But generally speaking, apart from being a professional, I think that we are all human beings that we would like to engage on such an endeavor, which is to support our nature. So from my perspective, in our everyday life, there are opportunities where we can think about what we are doing and maybe to readdress our everyday habits. The meals is one, for example, example. Now, with the hat of a professional and being member of some European networks, I fully support the idea of having synergistic actions between different disciplines. For example, I'm a physician, but I would love to work with other disciplines from in the environment. And we can, I think we can build on standardizing actually and improving our systems, our surveillance systems. There has been a talk and some information about AI tools and innovation. So let's apply our knowledge and combine in a way our knowledge to improve nature and planetary health for the future. So synergies and multidisciplinary approach in our sector, I think it's a major key for the future. Thank you.
Okay, thank you very much. And Sergey, he is not on my screen, but I think he's still there.
I'm still here. Thank you.
What is your one thing?
I think it's a difficult question. I think difficult to add what my colleagues already said. I would really think about changing our imaginations, and it's about kind of trying to think about what is possible and what is not possible in different ways. I think that would be really useful. And also in terms of professional life, I found it a very significant inspiration working with community groups and different actors to sort of think about what climate change entails. So in professional life, collecting, working with schools, for example, and developing sort of new ways of thinking about climate change for me was very inspirational. So working with young children and trying to ask them how they see the future, how they reimagine the future, for me was a really little thing which can make a difference because they have an opportunity, unlike us old people, or maybe I'm just considering myself to be old compared to them, but they still have an opportunity to change things far more dramatically than we do.
Okay, and finally, Claire.
So I guess to bring it back to sort of professional lives and into the realm of pathology, I think one of the things we can really think about is how we use diagnostic laboratories. There is so much waste when we request tests, sort of the reflex urine sample, because someone's looking a bit peaky, the sort of, I forgot to check whether this sample has been sent, I'm doing daily full blood counts just because. So for requesting clinicians, I think the single thing you can do in your professional life that's a small change is just check, do you really need the sample, and are you following the correct sampling procedures so that the sample isn't discarded or wasted? And I guess on the receiving end, we can just make sure that our guidance is clear, that we've got very clear guidance on what samples we want, how the specimen should be sent, and what the timings are, so that we're not wasting both the patient's time, the doctor's time, but also all the associated plastic, reagents, laboratory disposables, and I guess printers for results and storage for results that weren't needed in the first place.
Okay, thanks very much. So a variety of things there. We've got some more questions. So specifically asked for Professor Shubin, how could the COVIN-form approach be used to understand what drives healthcare workers to address climate challenge in the workplace?
Thank you, Samar, for this question. We didn't necessarily ask this question in the way you framed it, but what we tried to think about is the way in which we can redefine vulnerability, so rethink vulnerability as an ongoing kind of feature, as an ongoing process. So if we take on board this approach to vulnerability as something which is kind of rooted in existing inequalities, so very often a systematic issue, and we're talking about social, economic vulnerabilities here, as well as health vulnerabilities, and also something which is ongoing, something which is related to all of us. Perhaps to address your question is that we can try to think about the way in which people would not see the adjustments as something which is kind of an end state. They will continue to think about not kind of stopping, not having just a target to which they reach, and therefore they will kind of stop progress and stop thinking about the way in which they adapt to climate change and the challenges which it poses, particularly in terms of their everyday lives, and B, perhaps not projecting expectations on the other groups, which kind of are a bit out of place or out of time, which might not be necessarily applicable to them. So what we've seen with policymakers, they often made judgments about some of the vulnerable groups in the pandemic based on the policymakers' own experiences, which didn't necessarily apply to people like gypsy travelers or homeless people whom we kind of studied in our work. So perhaps thinking about the way in which people who, healthcare workers would try to kind of be sensitive and understanding of the variety of ways and time-specific and place-specific approaches to climate change, and therefore make these adjustments more contextualized.
Okay, thank you very much. I'm just looking down the questions now. We have got a question, but to be honest, I think Claire answered that question a moment ago, actually, and everybody has touched on it. So where are we now? So a question: parents tend to think that their children need meat for nutrition and growth. How would you persuade a skeptical family about this? So I think that is probably best addressed initially by Shireen.
Yeah, that's fine. Thank you. It's a common question. I think we all worry about children, and we've got used to the typical messaging that has really come from the meat and dairy industry over the years that have influenced healthcare curriculum and education. And we've all bought into this myth that meat is necessary. So I think we just need to be comfortable with the evidence. The British Dietetic Association have made it clear that plant-based diets are healthy for all stages and ages. So from cradle to grave, so there it's right there in the offing. We have many sources of information demonstrating that plant-based diets can achieve similar growth and development, so no detriment to growth and development for children who are being raised on a plant-based or a vegan diet. And so I think it just comes down to showing people that the evidence is there, role modeling yourself. We can't be great advocates for this way of living unless we're doing it ourselves, and getting people to interact with other families and children that have done the same. It's no longer uncommon to meet people who are doing this. So I think it's just about normalizing, and I think it would also really help if schools would be showcasing sustainable diets in line with the Eat Lancet Planetary Health Plate. And there are lots of initiatives in the UK supporting sustainable sort of eco schools, which are transitioning menus away from being meat heavy. So I hope that helped to give you some tips.
Certainly did. Now, one last question. So from a wider healthcare perspective, climate change will impact on the delivery of healthcare. And that's healthcare for everybody. I know people have touched on this already, but how do you think pathologists can get influenced in the debate? So I'm going to start off with Dr. Gordon for that one.
So I've talked about the diagnostic stewardship aspect of it, and I think that's an important bit. And I think another potential avenue is in communicating the risks, and actually thinking about the posters. And the reasons that we chose those posters is because the ones that we did highlighted climate change, environmental changes as a possible driver for the diseases they were seeing. And that's something that I think pathologists could definitely think about, when you're making reports, when we're diagnosing diseases, and certainly we do it in infectious diseases a lot. We can communicate that in case reports, in publications, and in forums like this. This is the disease. This is how climate change has impacted that. If we're reporting a specimen, there's a potential there, I suppose, for saying these are the risk factors for this particular disease and this is why, and just bringing it into sort of regular, everyday systems that we do, whether that's reporting results, whether that's presenting case studies, or in the case of infectious diseases, when we're assessing patients and providing results that we think this is the result of travel, of environmental exposures, etc., etc. So that's another way I think that we can contribute.
Okay, thank you. And to finish off, I'm going to put that question to Zoe.
Thank you, Mike. Actually, I fully agree with Claire that communication is very important for the pathologist and generally speaking for the healthcare providers, because first of all, we do have access and communicate with the population, with the public, so we can increase our imagination. I use also the word to find a way to make the public fully aware and engaged of the situation. This is number one. I think we can do it in our everyday life. Number two, for those who are also faculty members, I think that we have to train also our students to be more aware and more engaged about what is planetary health, what they can do in the future to improve the healthcare in general and their everyday life, focusing on the priorities that we just discussed. And number three, again, I will emphasize it. I think that we need to think a bit out of the box, both as pathologists and generally speaking as healthcare providers. We need to collaborate with other disciplines in order to have a more holistic approach, a more, let's say, in-depth knowledge of what is happening, and to really realize in our everyday life the connectedness that I mentioned before. So collaboration with other sectors, communication and engagement of the public, and of course the future generation. We need to train them on that. Thank you.
Okay, thank you very much. And thank you to all of our panelists for what has been an extremely informative discussion. And I think we should all go away and take things away from that, be that when we cook our dinner tonight or when we go to do our practice tomorrow. So thank you very much for a whole range of things. So thank you very much to Professor Sergei Shubin. Thank you very much to Dr. Claire Gordon. Thank you very much to Dr. Zoe Parna. And thank you very much to Dr. Shireen Kassam. That's absolutely fantastic. Thank you very much.